The neurological diseases in cattle. The congenital diseases are hydrocephalus as well as cerebellar hypoplasia, as well as lysosomal storage disease and inherited cerebellar dystrophy. The prion neurological diseases are scraby in sheep and bovine spongiform encephalopathy, also known as BSE. The viral neurological diseases are rabies, Ojeski's, looping ill, and Visna, caprine arthritis encephalitis, malignant cattle fever, and IBR, infectious bovine rhinitis. The bacterial neurological diseases are bacterial meningitis and meningoencephalitis, which is caused by Trupperella, as well as thromboembolic meningoencephalitis, as well as listeriosis and chlamydia encephalitis and parahypophyseal abscesses. The parasites that cause neurological problems are caenureosis, caused by Taenia multiceps, oestrosis, caused by Oestrus ovis, and hypodermosis, caused by Hypoderma bovis. And metabolic conditions can also cause neurological problems, such as vitamin A deficiency and vitamin B1 deficiency, and copper deficiency. The other neurological diseases are tetanus, botulism, and mycotoxins, caused by Fusarium, aspergillus, and rust and smut. For the congenital diseases, for hydrocephalus and cerebellar hypoplasia, it can be genetic or caused by blue tongue in lambs. And the acobane virus can cause it in calves, as well as bovine viral diarrhea. The signs are a dome-shaped skull and protruded eyes, and nystagmatus. The animals will have paralysis and they can't stand up. They will also have opitotinus. For lysosomal storage disease, this is a metabolic accumulation of glycoproteins and it causes neuroatrophy and necrosis. It happens in small breeds, and it is mostly fatal. If it's chronic, they'll have signs such as hyperesthesia. For the prion neurological diseases, in the case of scabies, it happens in sheep and goats. It's from the scaby proteinaceous infectious particle, which is a prion. Signs are scraping and automutilation, as well as weight loss and paralysis. They will get Downer syndrome. In the case of bovine spongiform encephalopathy, this is found in cattle, mainly in the UK. It's from a scaby prion, and the sources are bones and sheep meat. The incubation period is 3 to 5 years, and the signs are mad cow, so this is mad cow disease. They have apprehensive behavior, hyperesthesia, ataxia, and weight loss. For the viral neurological diseases, for rabies, it's a notifiable disease as it causes zoonosis. It is caused by the lysovirus, and it's from a fox infection. The incubation period is 3 weeks to 4 months, and the course is around 3 to 4 days. In cattle, in the aggressive form, they can have aggression, hypersexuality, and colic signs and salivation. They also have a loud, horse, or donkey-like bellowing. They can also get paralysis. In sheep, they mostly get the dumb form, which is anorexia, paralysis, and then death. And in goats, they get the aggressive form. They can get excessive bleeding, aggression, paralysis, and death. For the diagnosis, you need to do a PCR, and in the histopathology, you can see Negri bodies. In pseudorabies, also known as Ojeski's, it's caused by porcine herpes virus 1. For the signs, they get high fever, tachynoia, as well as shivering. You can also get paralysis and convulsions. For looping ill, also known as ovine encephalomyelitis, it's caused by the flavivirus and it's spread by ticks. It's mostly common in sheep. They get biphasic fever, as well as tremors and stiffness. And it's called looping ill because it looks like they're attempting to jump. For malignant cattle fever, this is spread by a herpes virus. It comes from sheep. There is no cattle-to-cattle spread, but there's from sheep to cattle spread. In the pathology, you can see meningitis and encephalitis. And in IBR, infectious bovine rhinotracheitis, it's caused by the bovine herpes virus 1. It can cause encephalitis in around 5% to 25% of calves. And in the case of bacterial neurological diseases, for bacterial meningoencephalitis or myelitis, it can be caused by E. coli, Listeria, Trupperella, and Mannheimia. It's usually from a hematogenous spread, but it can be from a local infection, such as a horn fracture. It can cause diffuse inflammation or a local brain abscess. Signs are high fever, pushing syndrome, spasms, coma, recumbency, and ataxia. For the treatment, it's not really done. They have a poor prognosis, so they're usually slaughtered. For thromboembolic meningoencephalitis, it occurs in bullocks in the autumn and winter. It is spread by Histophilus somni. They get necrotic foci in the brain. They can get convulsions, strabismus, coma, and it's called sleeper or sleeping disease. In the early stages, potentiated SAs might help. In case of listeriosis, it's also called silage disease. It happens in sheep in winter when there's overcrowded stables. Listeria monocytogenes causes pyogenic foci in the brain. They can get facial paralysis and salivation, and for the treatment, you give a high dose of penicillin. For prevention, feed a good quality feed and have good hygiene. For chlamydia encephalomyelitis, it's spread by Chlamydia pecorum. The incubation period is 4 days to 4 weeks, and the signs are fever and CNS signs. And in the case of parahypophyseal abscess, it's caused by Truparella pyogenes. So for the parasitic neurological diseases, for coneurosis, it's spread by Taenia multiceps. It causes cysts, and the signs are blindness on the eye, head pressing, head tilt, circling, and ataxia. And for the control, have dog deworming, such as praziquantel, and do not feed infected carcasses to dogs. For oestrosis, also known as nasal blots, it's spread by Oestrus ovis, and the signs are rhinitis, as well as cortical abscesses and secondary infections. And for the treatment, give ivermectin. And for hypodermosis, it's spread by Hypoderma bovis, and it causes skin lesions and bumps under the skin, but it can spread to the brain and cause encephalitis. And for the treatment, give organophosphates. And for the metabolic neurological diseases, for vitamin A deficiency, it happens in feedlots and in pregnant cows. The signs are night blindness, as well as syncope convulsions and paralysis. For vitamin B1 deficiency, it causes cerebrocortical necrosis. It happens in feedlots, especially with bulls and sheep. It happens when you give them a high grain, low fiber, high sulfate, and thiaminase and Clostridium feeds. For the pathogenesis, a high amount of lactate in the rumen causes a decrease of ATP in the brain. This will cause intracellular edema and degeneration, which will cause cerebrocortical necrosis. The signs are blindness, tremors, and seizures. And for the treatment, give a high dose of vitamin B1 IV. For copper deficiency, it happens mostly in pregnant ewes or lambs. It's due to an increased copper demand. Due to the decreased copper, it can cause cerebellar hypoplasia, and the signs are recumbency, death, ataxia, and incoordination. Other diseases are tetanus caused by Clostridium tetani. They will be in a sawhorse position and to have rigid paralysis and bloat. As well as botulism, which is caused by Clostridium botulinum, cause true flaccid paralysis. Other causes of neurological conditions are fusarium, aspergillosis, rust, and smut.